few things that come up. As most of you likely are aware that on Monday, 24th, Fond du Lac is moving back down into phase 1 of the Safe Restart program that they're working with. Substantial increase in positive COVID-19 tests in the community due to large group gatherings where social distance guidelines were not practiced. They also indicate the individuals were attending these gatherings with minor symptoms. They were often dismissing symptoms as allergy related. So, just so y'all are all aware of that. With the return to phase 1, our ministries are looking at what steps should be taken to help reduce potential exposure. As an employer, we are also seeing increase in employee testing positive. As these test results are confirmed, we are taking immediate and appropriate steps to work with any provider or employee served alongside these specific employees. We are continually taking steps to ensure safety of our patients as well as appropriate staffing and enhanced cleaning. Additionally, we are asking employees to be aware of their own health and to not report to work if you are sick. I am going to note that some of you probably have heard some things about 5 South. I just want to reiterate, it is not isolated to 5 South. We should be taking all these precautions everywhere, obviously. If you're continuing to do what we've been doing, masking, goggles, PPE, following all the precautions, you're doing your part.
Right, and our infection control department, just like the CDC is saying, that your exposure time is what really it's all about. So it's that 6-foot distance for 15 minutes or more without proper PPE. So we're really not. We're probably safer here at work than we are going to the grocery store, because a lot of people aren't wearing their masks out in public, and here we have to. We're really cognizant of wash your hands, don't touch your face, keep your mask on, keep your goggles on. All of those things that we're doing here really keep you safer than you are out in the world.
So with these developments, employee health is continuing to work by tracing any of the employees who test positive. The employees are immediately tested, quarantined, and followed up with employee health. This coming week, the community is doing a drive-through testing. I have a little tidbit about that here. It's Friday from 11 till 7 and Saturday from 8 till 4. It says it's at the highway department, so the information for that is going to be right here.
And it is free.
Yes,
so
it's free.
They're encouraging people, symptomatic or not, if you want to get tested, you can drive through and they do the
Even
rapid
though
test.
the CDC now says that if you don't have any symptoms, you shouldn't get tested.
They're doing it this way here.
And for our county.
Yeah,
Okay.
for our county.
And then employee screening. Starting Monday, they will be starting employee screening again. You'll either do the screening tool on your phone and present it to the screener when you walk in, or they'll ask you the series of questions again like they were doing before, and taking temperatures and things like that, just like they were before. Visitor guidelines, they have now changed the visitor guidelines back down to only having visitors to patients with exceptions like end-of-life situations, when it's essential for a patient's well-being and emotional care. In women and infants, they're allowed 1 visitor for their whole stay. And in pediatric settings, 1 visitor as well. It's critical in this time that employees and providers remain vigilant in any symptoms they are experiencing, including fever, trouble breathing, headache, muscle pain, sore throat, loss of sense and taste, cough, chills, fatigue, runny nose, nausea, abdominal pain, vomiting, diarrhea. In recent positive cases, employees have reported feeling off, head congestion, runny nose, back aches that are not normal. All of them symptoms are going to be listed right behind Jan there. We have the stuff posted. It's actually the one behind Allison. The one behind Jan has the PPE, the precautions you're supposed to take, all of that.
And the biggest thing on that is what is not normal. Like for me, I got up every morning because I'm old and then my back hurts every time I get up. But it's
Yes.
but that is that is normal, you know. So it's like if something comes up that is out of the ordinary for you, that's when your concern level should rise. Okay.
Any employees or providers that have any of these symptoms should immediately call employee health. I can put the number up unless it might be on one of those. I'll put the number up for employee health so that it's here, so that everybody knows. And then the COVID clinic, I will put that up as well, the phone number to that. So we appreciate everybody continuing to do their part to keep themselves and our associates and our patients safe. So if you have any questions about any of it, don't be afraid to ask any of your leaders. And we're all gonna work through it together.
All right.